we go ahead and get started?
Okay.
Okay.
Got a few things to talk about. There hasn't been a whole lot of change in the issues we're following up on Capitol Hill, just a little bit of stuff. Probably the most interesting stuff to talk about, though, will be related to what you all are doing and what we're trying to get started doing in terms of grassroots advocacy going forward. So just to update people on what's going on Capitol Hill, we've gained a co-sponsor of the Medicare bill, which we're very happy about. First co-sponsor of the year, so we're up to a grand total of 11 co-sponsors in addition to Senator Wyden. The new co-sponsor is Senator Daniel Lakaka from Hawaii, and as I'm sure you've all heard me say more than once before, we'd very much like to get 20 or 30 senators co-sponsoring the bill. So, and we can talk about that more when we get into the grassroots stuff. The other big piece of news, it's probably even a bigger piece of news, is that the Department of Education has put out a request for applications for grants under the Elementary and Secondary School Counseling Program, finally. We expected that to happen earlier in the year, and we're starting to get a little concerned. But they finally put out the announcement and had the Federal Register notice and everything. So now if you go to the ESSCP program's website, you'll see information on the application process and the fact that the application closing date is May 25th. They're evidently planning on giving out about 60 different grants, and the grants are usually in the neighborhood of $200,000 to $400,000. So anyone who's connected with a school counseling program might want to submit an application. The website for that program on the Department of Education's website is www.EDD.gov/programs/ELSECCOUNSELING/applicant.html. If you just Google ESSCP, it's I think the very first thing that comes up, so it's pretty easy to find. Nothing new on TRICARE that we've heard recently. Art, is there anything you want to tell people about the VA?
We've got some good meetings with some more officials at the VA. Primarily after we got back from the conference, we had a meeting with Dr. Alfonso Batres, who is the head of the Readjustment Counseling Services Program for the VA, which, if you all are familiar with the VA, they are the ones that primarily are responsible for the vet centers and the vet center program. And we met with him and along with the NBCC and AMCA and the Marriage and Family Therapists groups, and it turned out to be a very, very positive meeting. He expressed an interest to have an ongoing dialogue with us as we keep moving forward on our efforts, which is, I think, something that, while I don't want to say the other officials have not said or not, agreeable to that, they've never come out and said it. But he was talking about, looking at scheduling quarterly meetings with our group, which is also hopeful. So as they're starting to formulate policy, where we can actually have a discussion, that dialogue before they put pen to paper, hopefully, at least with that department. We also had a couple meetings with the Senate committees of Veterans Affairs, both the majority and the minority, to talk to them about our concerns and our issues, and let them know that we'd like them to start looking at that, and those issues proved to be, or those meetings, I should say, proved to be very positive as well. I think what we're going to work at least with the minority on is they said that they'd like to send some more questions over to the VA to get some clarifications on our issues and some of the solutions that we proposed, or some of the changes that we proposed, such as making sure we've got more counselors in the internship programs when they're coming into the VA. So, uh, just all in all, at this point, that's what we're looking at. But I think that we're still moving on a positive direction. It's just as these things do sometimes taking a little longer to get to a resolution. But I think we've got good sentiment on the Hill and good support on the Hill to get this moving forward. So.
Okay.
Any questions on any of those issues or any others that people have?
Well, I guess I'm getting a little confused between veterans and, active duty service people now. From what I understand of what we're saying, or I'm going to ask you for clarification there. We want to see veterans. Is that is that one of our goals? And when we talk about see them, we want to be hired by VA administration, but we also want to be able to practice to see veterans independently. Because is that a separate issue from TRICARE? Because TRICARE doesn't cover veterans; they cover active duty servicemen.
Right.
That's correct. TRICARE doesn't. When we're talking about the VA, our primary goal with the VA is the fact that several years ago, 6 or 7 years ago, depending on how you want to count it, Congress passed a law that allowed the VA to start hiring counselors into their medical programs, into the Veterans Health Care Administration. And the VA has not been doing that with the urgency that we would like. And so we've been working with folks to see how we can remove those barriers and obstacles to make sure that we've got, number one, when they have vacancies, they being the VA, that they're opening them up to counselors as well as psychologists, psychiatrists, psychotherapists, social workers, and things like that. And also that they're looking at a way to help grandfather, for lack of a better term, counselors that may be within the VA system that are not practicing as counselors, to give them a professional identity. So those are our primary goals when we're talking about the veterans community per se.
Okay.
If a veteran, because if a veteran if the veteran is going to see a counselor, most likely, not obviously 100% of the time, but most likely, that veteran's going to see a counselor because they've got some sort of issue that's related to their time in the service, and that's a combat service related injury that would be covered under the VA. So that's why we're trying to get in the VA, because the VA is going to be servicing these folks and providing mental health services for these folks.
Right. In the VA. Yeah, I think I was getting confused myself about that, thinking that there was another component with the VA which spoke to outside professionals. I hear about it sometimes, but that's not true. There's no funding for. They
do work with outside providers in what's called a fee-for-service basis, where if there's nobody else that could provide, if there's not a VA facility or practitioner or provider in your area, but you've got some. Let's say if I've got if I've got a heart condition and that heart condition is service connected, and there's no cardiologist within 200 or 300 miles of me, but that's a VA center, or I should say, a VA clinic or a VA hospital, but there's a cardiologist that's there locally. You can go through the fee-for-service basis program, and then the VA will, anoint that provider to look after you.
Okay, I'm clear.
Okay.
And
that is separate from the TRICARE issue.
Right, exactly. Okay. These things can be so complicated,
Yes, they certainly can be. That is true. Any other questions that people have on the update?
Not here.
Yeah, okay. Well, in that case, why don't we shift to talking about some of the grassroots stuff that we've been working on, some of the people on this call with, and some other counselors with. including a visit or two to legislators in Connecticut, and we've also had Greg and Chris Roseman talking with councilors in Ohio about some of the stuff that we'd like to see happening. We've also had a conversation recently with councilors in Idaho, councilors in Colorado. Is anyone want to talk about either the Connecticut or Ohio stuff that's been happening, or discussions that have been going on?
Yeah, Scott, this is Greg from Ohio. We had our executive council meeting for the city association on Friday and Saturday, and I shared all of the information and the wish list that you had sent. Thank you for sending that, by the way. And had a lot of interest from the executive council members. And what I'm doing right now to expand that is putting a initiative together in a large email to send out to the listserv that will go to about 4,000 to 5,000 counselors within the state of Ohio, asking them to get involved and complete those specific tasks or wishes that you had sent to start with, and then also to canvass the rest of the state and try to get, well, my goal would be to get all of the congressmen visited personally, and then also the Senator Portman, have him visited on the Medicare issue and send the thank yous out to Senator Sherrod Brown. So that's the step that I'm taking next, is to expand it to the whole listserv, to the whole membership for the Ohio Counseling Association, and rally the troops, so to speak, and get those tasks finished, and then just continue on with those things. And I'm going down to Ohio University next week to present on advocacy issues for their local Chi Sigma Iota branch, and we'll take those down there because I believe one of the congressmen fits in that district, so we'll be sure to focus on that when I'm down there speaking. So, plus we have our Legislative Advocacy Day coming up on May 14th at the State House in Ohio, and I'll be covering the federal issues and encouraging the members to get involved with those initiatives as well and write letters from the example that was given out at the Midwestern Region meeting on Medicare specifically and some of the other issues. So that's a quick wrap-up of what I'm doing in Ohio to get things going. So
that's great.
Yeah. Okay. Questions? Anything I'm leaving out? So.
You may or may not have gotten any feedback on this, but if and when you do, feel free to pass it along. I don't suppose anyone said anything about the types of information that would be helpful for them in doing this sort of thing, or ways that we could try to make it easier for them from our perspective here in the ACA office.
Yeah, those are things I'm getting a list together of some things. Just I have the talking points on Medicare, and I've summarized some things with TRICARE and the VA for the membership as well. And so I'm taking a closer look at that, and we'll hopefully have a list of some things that will be helpful once I get some feedback back from some folks. So I will keep you posted on that.
Yeah, okay. Great.
Yeah. So trying to get it done. And I'm asking for feedback when people make visits or write letters or give the personal vignettes, have them send them to me so we can send them to you, kind of like we did 2 years ago. So,
great.
Yeah, so hopefully
Lauren, anything you want to pass along about the stuff that you and your colleagues have done in Connecticut?
You speaking to me?
Yeah.
I'm really just kind of new to joining the group, and I thought my other counterparts would be on. So no, at this point, I don't have anything to offer.
Yeah. Okay. Fair enough. Well, as research shows, nothing works better than constituent contacts, and nothing was better than face-to-face constituent contacts. So the more things that Art and Gila and I can do to help counselors contact members of Congress themselves, or meet with them, write them, call them, et cetera, the easier our job as lobbyists here in the D.C. office is going to be.
This is Bob Doppler from New York State. Can I make a comment?
Yes,
Sure.
definitely.
I'm not sure how much you folks are aware of what's going on in New York State. We've had an ongoing problem with. The good news was back in 2005, the state passed a licensed mental health counselor law. But since then, the state education department has taken a pretty strong stand that because the word diagnosis is not in our scope of practice, therefore licensed counselors cannot diagnose. And it's causing all sorts of confusion and reticence among directors who then are not willing to hire or promote licensed counselors. And we're trying to deal with the state education department as well as the legislature about this, but it's just been quite a difficult situation to the point where some agencies, I'll say many agencies, will not even take master's level counseling students as interns because they don't anticipate being interested in hiring them.
Huh.
So I just wanted you folks to be aware of that. I mean, there is a grassroots effort trying to deal with this. Our state mental health counseling organization is pretty active, but it's causing a lot of strain for counselors in New York State.
Well,
Ooh,
we would be.
awful.
What was that?
I just said that's awful. I'm just made a comment.
Yeah. We would be happy to help out any way we can on that, whether it's sending a letter to state legislators or to the State Department of Education, sending something out to ACA members in the state. So if anything occurs to you that we can do, or you hear of anything, or know of someone that we should be talking to on that, let me know, because we very much would like to do what we can to fight this sort of thing.
I certainly will, and I appreciate the offer.
My email address is sbarstow, SBARSTOW, @counseling.org.
Great. Thank you, Scott.
Sure. Art, anything that you want to relay about what we are hoping to do over the next month or two on grassroots?
Yeah, I just wanted to also just say that we wanted to thank everybody that came by and that we got a chance to speak to at the conference. I know that sometimes this is a little weird, these phone calls, because you always hear our voices and we always talk about all these things, but we never get a chance to see each other face to face. So it was nice to see that and put names to faces and talk a little bit more about that. And I think that Scott would agree that we were also very thankful to all the folks that were in the region meetings that allowed us to stop by and visit with you and talk about the work that's been going on. I think that, this was being my first conference. I know that there's, found out that there's a lot of things that are going on, not only just day to day, but literally hour to hour, and we can't ever be where we want to be all the time. So I think that by going to the region meetings, it was nice to meet some folks that we might not have already met and talk to them more about our grassroots efforts. And to hit on that, I know that we were discussing this earlier, but we did hand out have a handout that was, kind of our wish list or plan to victory that included some different pointers about grassroots advocacy, and it also included a template, a letter template for letters that you could send to your member of Congress as well as your U.S. Senator. And if anybody that was either was not at the conference, not able to attend, or not able to attend a region meeting, and would like that, just feel free to give Scott and I a call or email Scott and I, and we can send that over to you because it is available electronically, and we want to make sure that everybody's got that and can disseminate that to other counselors that you know and that are interested in working on these issues. Wanted to let you know that we had a great session, but we also were doing another activity, which was we were gathering some ACA members that were also veterans to create a new interest network. We talked to some different folks, and obviously, since we've been working on issues regarding the VA as well as TRICARE, we noticed that there was a kind of a voice that we wanted to make sure was being heard, and that we could work with directly to get active duty folks or people that have been active duty or veterans and get them organized in a way so that they could share their stories, share some of their experiences, and also share ideas about how to collaborate and best practices in the field, not only there but also within the counseling field, as well as with working with the grassroots efforts as well, and working with the public policy team. So we're on our way to creating a interest network within ACA for veterans. We had about 11 people that showed up at the meeting, and then we've had some other folks that have been calling in. And if anybody is on the call and is a veteran and would like some more information, feel free to give me a call, and we could talk a little bit more about that offline. But we're really excited about this initiative, and I think it's going to be a great new feature that we're going to have, and a great new group that we'll have with ACA.
Art, this is Bill Braden.
Yes, sir.
I've got a former officer that would be dynamite. He is just, he finished a career as school counselor, and he was a reservist, and he's gone all the way to bird colonel in psychological health, and he's just retired. And we've just been in a battle, and he's been very helpful, and I know he'd really be helpful for you too.
No, it'd be wonderful if
I'll hook you up.
Yeah, that'd be great. I'd love to chat with him. Also, as Scott mentioned, we had our first ever ACA office visit in Connecticut with a couple of ACA members who were interested about participating in grassroots and had never really done anything, I think, like that before. But they had got together, and the three of us had gotten a call, and we had some other calls following up to that, and worked with them to provide them with some information. And they were actually able to schedule a meeting, not just with their congressional office, but they were able to get an actual meeting with their member of Congress and sit down with them and talk to them about issues that counselors were concerned with, and talk to them about our issues and about some of our legislation and why it's important to us. And it was much easier and painless than they thought it was going to be. But they were very excited. We were very excited and happy that they were able to do that. And they also decided that since we've got a Senate bill that's in that chamber, that their next step was to schedule a meeting with their United States senators. And so we're obviously very excited because it's part of our grassroots plan that's coming to fruition. But it's also, proof positive that counselors can do this, and counselors can be effective, and we can get counselors into these congressional offices to tell your stories and talk about why this is important. As Scott mentioned, we also had some meetings with some folks in different states. So we're going to have some follow-up meetings with some folks in Idaho and Colorado in particular to get them scheduled with their office visits. I think that we might have some in a couple of different states to talk about VA issues as well. So it looks like we're starting to get in that direction and starting to get some movement. I was really glad to hear from everybody that I talked to at the conference. Part of the challenge when we're not just in this organization, but any organization or any place where you're doing this is when you're starting a grassroots program, it's always hard to get volunteers and people that are willing to engage in the process. But what I really enjoyed and was really heartening after conference and during conference and since and before is that the sentiment I keep hearing from counselors is, how do I get involved? And people are willing to participate in the process, and they just want the tools to figure out how to do this. So I think that's a great start to that process, and it's going to put us ahead of the game. But that's what we're looking at now. Are there any questions regarding any of that?
Bill again. Let me share with you something's happened at the grassroots here that sometimes these are stimulated by national trends. I haven't heard of this before, but I'd like to share a heads up if I may.
Sure.
We had a bill in the current session, and we've got it in the vernacular under house arrest, but it would result in the licensing of alcohol and drug counselors with just almost a peer counselor type, that they could get grandfathered in without hardly any education at all. And that's really dangerous, given PTSD issues and issues from so many veterans that have returned to their communities and don't have access to help. Mm-hmm. And but so far we've been successful in keeping that from moving. But that's a few years ago we had a variation of the psychologist test monopoly, and we were able to defeat that too. But you really may be asked for help from people if this is going to be a national move, because it's really dangerous.
Yeah, and I think that's important, because sometimes we see that if some folks have an interest in a particular profession or a field or things like that, if they're not successful, or sometimes they just choose to go the state-by-state route. So I think that you're right. It's important to be vigilant about these issues, and thank you for sharing that, because it gives us a heads up to keep an eye for it, as if this group is trying to do things the same way across the country.
Yeah, I'll keep you informed about this too. The status is now we're in special session. We're still vulnerable probably, but I think we're going to succeed.
Yeah.
I'll keep you briefed.
Thank you. Any other questions? Any other concerns or anything else that people wanted to mention? Okay, Scott, are you still with us?
Kind of a quiet group. Before we sign off, Art, can you give people your email address if
Sure.
they have any questions and want to follow up with you instead of me?
Sure. Let me give it a couple of times. It's a little longer than Scott, so I apologize. But it's A as in Apple, T as in Thomas, E as in Eagle, R, A, Z as in Zebra, AS @counseling.org. So once again, it's ATERRAZAS @counseling.org.
Okay.
Right. Well, thank you,
one
everyone.
Other idea.
Yeah, go ahead.
I think you and Scott are really getting some great grassroots things going. Maybe some reporting on some of those might inspire others.
I think you're right, and the folks, the counselors up in Connecticut had mentioned the same thing, that they wanted to share their story. So I think we're going to look at a way where we can do that with this group and with other groups across ACA, so that folks can see that they can actually make an impact and participate like this, and like you said, sharing that story is going to help and goes a long way. So thank you for that. We're going to look into some ways where we can do that.
Yeah, it's a very good idea, Bill.
Thank you.
All right. Well, we'll turn everyone loose. Thank you all for joining us.
Thank you.
And we'll be talking to you later.
Okay.
Bye-bye.
Bye.
Bye-bye.